So I have a short time and I have a lot of stuff that I want to talk about. So the first thing I wanted to say to you is that the people sitting in this room, if you're going to work with Lyme disease patients, you have to think about yourself as a lifeline, because that's really what you are for a lot of Lyme disease patients. And the reason that you're really a lifeline for Lyme disease patients. And why I say that is because often you are the first person who will really listen to a patient and consider, okay, if you're Lyme literate, if you're learning about what Lyme disease is, you're here today to learn a little bit about it. So if you have some knowledge, you're really the first person that might consider that it could be Lyme disease. Maybe a doctor's done a Lyme test before, but maybe the doctor may not have been uneducated. I know that Angela spoke briefly about some of the diagnostic problems. So, there are many diagnostic problems. There's problems with poor testing, because the body, some of the sicker clients that you may see, if they're not developing an antibody response, they're not going to have a positive test. So that's part of the problem. The other thing is that it's a very evolved organism. So I know she mentioned that before, but the organism can actually cloak itself, so if it's hiding in tissues, you won't be able to find it. I had a patient who was sick for about 10 years. The tests were constantly negative, 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 negative. So, it's something that you have to consider, is that you're really the lifeline. And also, you can be a bridge. Now, it's a little bit of an ethical dilemma with being a lifeline, because you're not a medical doctor, but you might think that the patient in front of you has Lyme disease. So what do? You can't say to the patient, well, you have Lyme disease, because that's not really an ethical thing. You're not a medical doctor. But what you can do is you can talk to the patient about your concerns. You can tell them, have you ever considered this? Have you been tested before? Kind of just make it a dialogue. At that point, then you can say, what is your doctor treating you for? And then say, can I speak with your doctor? And then see how open the doctor is to the testing of Lyme disease. So you can kind of be a bridge. So you're a lifeline. So then you get a written consent from the client. You can talk to the doctor. You can also make referrals to Lyme literate doctors so that they can make that determination. So it's a little bit of an ethical dilemma, but you have to think about that when you're working with patients with Lyme, that you believe may have Lyme disease. There's also a lot of political stuff going on, so I'm going to kind of I'm not going to talk too much about it because I don't have a lot of time, but I have to touch on it because it affects the functioning, the stress responses of the people that you're going to be working with. So if a patient has been sick for 4 years and they've gone from doctor to doctor and they come into your office and they tell you, I keep all my notes at home and I've been having this symptom and that symptom, and you start asking them, like, what do they do in their spare time? When do they remember getting sick? How did it start? What doctors did they see? And they're going to start giving you a picture of what's happening. So the longer they're going through this process, the more impaired they're going to become. So you might be seeing them when they're already so impaired that they can't even make a decision. They can't even make a decision about if they should go to another doctor, because they might feel so angry at the system. So there's a lot of trust issues that can come up when you're working with Lyme disease patients. Particularly, also, it can come toward you, and we'll talk a little bit about that, and the transference issues that can come up clinically. The other thing is that medical providers will often turn to you. They're going to look to you because maybe they've had, because of the insurance dilemma that we have in this country, oftentimes people go to HMOs. So maybe they go to their primary physician and the doctor says, I don't know what the problem is. So, he says, I think you're depressed. So then he'll say the first thing that the person will do is turn over to a mental health provider. So if it happens to be you, when they come to the office, then you are in a predicament now as to what to do with the patient. So really having a knowledge of Lyme disease and becoming Lyme literate will increase your chance of helping the client. So that's really why you're a lifeline. That's why I use the term lifeline. It also will increase your ability to empathize with people if you're Lyme literate, because people can come into your office and talk about a lot of different issues, but if you're Lyme literate and you know about the politics of the controversy surrounding Lyme disease and why there's lack of education, then it will build your empathy for people who are going through this disease. And then the other thing that you have to remember is that because it's an ethical dilemma sometimes, you have to utilize the patient. So, okay, a patient comes in your office, it's been 4 years, they don't know what's wrong, they feel downtrodden. So how do you help? You have to help to build them back up so that they can advocate for themselves. You have to help them to find a way so that they can go on. I have a woman that I work with, her son is very ill. He's been sick for probably like 6 or 7 years, and she's been to multiple doctors. He's had every diagnosis known to man. He's also had 4 tick bites. So, and he's been, every time he'll go to the doctor, say, oh, well, he had antibiotics, he's fine. And he just isn't getting any better, and it's really, the mother, like, is given, she just doesn't know what to do anymore. She's at her wit's end, and I just keep saying, you're just afraid to ask, like, to ask the doctor wanted her to do 3 things to get into the office. He's a Lyme litter doctor. She couldn't do the 3 things because it felt so overwhelming. So it might just be about working on what are the things that you need to do to get help. What do you need to do? If it's that you need to make a phone call one day, and set up the appointment. And then, so you might have to kind of lead them through the process if they're in a really bad way. All right. I just want to go back over some of the diagnostic problems that Angela had mentioned before. Part of the problem is that laboratory testing, like when they go to the doctor, is not of complete utility in determining infection, and that is because of the nature of the way that it's tested, and also because laboratories, and I know that Judy had mentioned this also, that laboratories have differing ways of like saying, okay, so if you go to one lab, they'll say you have to have 2 bands for an infection. You have to have any band and you're positive for Lyme disease, and then you go to another lab and you have to have 5. But the reality is that you don't have to have any. And it's really a clinical diagnosis. But medical doctors aren't learning that in school, so that's very unfortunate. And it causes this pronounced problem of people waiting years and years and years to get diagnosed. So this is why what I'm saying is they're in a state of what I'm really talking about today is chronic Lyme disease. Is people that are in a state of limbo for a really long time, and again, they're going to be more impaired because they've been in the state of limbo. So some of the things, like I said, the medical provider may say, you're depressed, go see the mental health provider. So, or they may have given other diagnoses like somatization disorder, hypochondriasis, a pain disorder, depression, PTSD. I mean, there's multitudes, OCD. I mean, there's just multitudes of diagnoses that you might see. But because you are trained, when you go to graduate school, what's the first thing you learn? You learn how to do an assessment. You learn how to talk to someone. You learn how to listen. Listening is key to the work we do. So if you just keep remembering that, you're going to hear clues that maybe a medical doctor would miss because you have a longer time. You're meeting with a patient for like 50 to 60 minutes at a stretch. So if you're doing that, maybe a doctor meets for 10 minutes. They focus on, like Judy says, one thing. You can focus on many things, and you can start to ask the right questions. I don't have time, unfortunately, to tell you what the right questions are, but hopefully from the information we gathered today, you'll be able to sort of think about those for yourself. So now, I wanted to tell you about some key interventions that I think are the most important. I just wanted to give you clinical, useful tools that you can use with Lyme disease patients. So the first one that is the most important is to believe in your patient. And it is so important because so many patients that you're going to see with chronic Lyme disease have been subjected to terrors that you just can't imagine. Healthcare providers that maybe have been abusive to them. So you have to know that believing in them is really the key thing. It's really kind of like a stronger kind of empathy, belief. Okay? It hears and it reaffirms the person's innate truth. So when someone goes to them and says that it's nothing, what's happening to you, that like your symptoms are not really happening, then it really denies to them that their truth is real. And anytime our truth is denied, then we feel completely ill at ease, we can't function. So you're going to help them to reaffirm that, to get that back, to get that sense of truth. So believing is number one. Never forget anything. If that's the only thing you take away, belief is key. Okay, then the next thing I wanted to talk about is a little bit about grief and loss. So grief and loss is going to look different in a Lyme disease patient than maybe in other conditions. other than, like based on the fact that it can be ongoing, the disease, it can cause ongoing problems, and also because of the diagnostic dilemmas and the political controversies that are surrounding Lyme disease. So the symptoms also can come on very quickly and can feel so strange to the person, and the loss in functioning can be so pronounced that it can lead a patient to appear kind of out of sorts or crazed to other people. So who really wants to be around somebody who appears kind of crazy, out of sorts? Okay, and the person may feel they're like that too, because they don't know what's happening. It's just too many symptoms at one time. So this leads to really a lot of alienation, even if the person has a family that's supportive, because they might not be able to express. I mean, it's hard to talk. Think about it. It's hard to talk about pain. How do you really describe pain? The language of pain, like, it's very difficult. So, I mean, I think that that's something to remember, that they might feel very alienated from just even an experience of how do they get to something? How do they? So grief and loss is going to look a little different. Like, again, there's going to be sometimes a loss of physical functioning. So maybe they aren't able to do work. Let's say they work as a construction worker. They can't, do the same job anymore. Maybe they're walking with a cane or they're in a wheelchair. Maybe their cognitive functioning is so impaired that they can't do their regular job, so they needed to cut down their hours and maybe work at home because they just can't do it anymore. There's emotional ups and downs that can happen with Lyme disease. So maybe one moment they're crying for no reason and they don't know why, and then the next minute, they're laughing, or they're just totally depressed and sitting in a corner. I mean, the change is just very profound. And also, the reason why grief and loss is I think is so particularly difficult is because it causes a lot of economic issues for people. And I don't think we talk about that a lot with our patients, but I think it's a really important one to know with Lyme disease patients, because of the controversy, a lot of insurance carriers don't cover treatment, and people are really pigeonholed. If they want to get better, they have to spend a lot of their own money to do that. And if people are, come from a poor background, they can't really afford that. So, it creates a lot of problems. It creates stresses in the family. How are we going to come up with this money? Should we mortgage our house? Should we do this? Should we sell our house? Should we move here? I mean, these are the basic things that people are going through when they're dealing with this disease. And also, the other thing that I think is really important is about the loss of friends and family. Sometimes people who love people with Lyme disease don't know how to handle it. Not that they don't love the person, but maybe they just aren't equipped to deal with all of the changes that are happening in their life. So there can be either a major separation or just kind of like an underlying conflict going on that's creating a stress for the patient, or there can be a true enmeshment. I've seen either, it seems to me I've only seen one or the other. It's either there's some kind of slight undercurrent of a conflict, they don't talk, or there's this kind of enmeshment where the whole family just pulls together and everything is about Lyme disease and we have to be active. And so, but you have to be aware that that might be something that maybe the patient isn't even wanting to talk about. They might not even go there, but if you're aware that that could be an issue, you could bring up, well, how are things at home, or how are your parents helping you, or how's your husband or your wife, or just kind of talking about that with them, just to get them to kind of explore it and see if there's any way that you can maybe, I don't know, make things a little bit easier for them, have a dialogue, maybe you could do some family therapy, or whatever it is that the patient is needing at the time. So also, because of the controversy, the client can have intense anger toward the medical community who has misdiagnosed them or wrongly diagnosed them. But also that anger can go toward you in the therapy room. So now, of course, you're not the person that wronged them. You didn't wrong them. But we know what countertransference and transference is, so you are going to take a lot of that when they come to the room. They might not trust you because you're really part of the establishment. Even if you're not a medical provider, you're a care provider. If their doctor who didn't diagnose them sends them to you, they might feel like, oh, you're part of the package. I don't know if I can trust you. So you have to be very much aware of that when you're working with patients. So, and also in order to, if you are aware of that, then, and you can deal with that, and you can start to talk about it soon and acknowledge what it is, then you can build a therapeutic alliance. Because of course no work can happen without that. Okay, so the strongest feeling states that you're going to encounter around this issue will be shame and dread. Shame and dread. Now, these two issues, shame and dread, are two of the most complicated feeling states to work with. I mean, I'm sure with any other patient you've ever worked with, if it's ever an issue of shame or dread, it's very hard to manage. So you have to be aware of that. So just, if you're starting to feel that inside of you in a countertransference reaction, just use the feelings you're experiencing to bring it to the patient. Start to talk about what it is, and then you can sort of illuminate, well, okay, so you're feeling this way because, and just kind of get at that. But those seem to me to be the two strongest feeling states when you're dealing with that issue, shame and dread. The next intervention that I think is really important is encouraging hope and faith. Now, you can't really encourage hope and faith about outcome because we're not God. I don't have any control over that. But what you can do is to help the person have hope and faith that they're going to get some answers to their questions or make some choices that will help them. So for some people, this just may mean that for some people it may mean, hope and faith may mean I have to be cured, or I'm not going to be happy. Or for some people it may mean I just want a reduction in my symptoms, I want to go back to work. For some people it may mean remission. It just depends. Everybody's different. But hope and faith that whatever their outcome will come is important to instill in them and to work with them on. The other thing, some kind of way of understanding what's happening, because we're never going to know the why as humans of why the person has the disease. We don't have the answer to that. But to ask the patient, well, what is this journey meaning to you? What is it about? Like creating like a symbolism around it will really help. And for some, this may be seen in you can see it in the many wonderful Lyme patients who become advocates and healers and do all these things. So that's their meaning base. They've done something, they've taken something that was difficult and turned it into something different and positive. Okay, how much time do I have?
5.
How much?
5 minutes.
5, okay. All right, so I just want to talk about suicidality, and if I have time, we'll talk about a Herxheimer, because I think you need to know what that is. But, feelings of suicidality sometimes will happen in a Lyme disease patient, and when I generally see it, it seems to predominate during either pre-diagnosis, meaning when they've just been in this state of limbo, or when they're getting treatment but they haven't noticed any changes and they're still feeling really sick. So I call that pre-symptom reduction. So those would seem to be the two areas. And of course, Judy had mentioned before that there's a lot of brain, you have to think about the brain function. So of course part of that is related to circuitry, but then also I think there's a deeper psychic need to regain control over a body that you've lost. So it just, everything feels out of control. So I've termed this body escape. Okay? And body escape is a way for a client to feel a sense of control. It only refers to the conversation of suicide, okay? The storyline, the ideation, not so much the intent. Many Lyme disease may have a plan in mind. It may serve as a function of letting the person know that I can still do one thing with my body that this germ cannot do. It is the ultimate, absolute, most difficult topic to work with. And why it is because suicidality is always hard to work with. I mean, it's the hardest thing you'll ever have to work with. All the research tells us that. What is, when it asks clinicians in any research, what are the issues what are the most difficult topics to talk about with your patients? Suicidality always comes up as number one. But with Lyme disease patients, you might have to talk about that a lot. You might come up a lot of times. And it's not maybe that they really have the intent to do it, but it's just the conversation about, I have no control over what's happening to me. I want to get out of my body. And this is just like the last escape. I just want to feel like I can do this. So you have to learn how to find a way to sit with the uncomfortable feelings of someone talking about death and deciding whether it's reportable, because of course you're a mandated reporter, and if we have an ethical obligation to our clients, or is it just body escape? Are they just talking? Are they just getting it out? Are they just venting? So sometimes just the act of talking about it for a prolonged period of time with the provider, like during the hour session, can just be enough for them to continue on when things are seeming bleak. You can remind them that they're seeking a sense of wanting control back. So just like frame it. This is what it is. You feel out of control. This is the reason. And also it helps them to know that you're really hearing them and you're really seeing the struggle that they're going through. And this reminder of control can shift them into what other things they control. So like they can control what treatment they choose, what doctor they go to, who they get support from, any other subtle changes or, any other subtle areas of their life where they can pick something, that is where they do have control. So you can just kind of bring it back to that. I mean, of course, the regular interventions, reasons for living and things like that, those will help, but you need to also remember that it's a conversation about just getting out of the body. So I guess we might have time. I just wanted to talk with you about what a Herxheimer is. So a Jerry-Herxheimer reaction is when Lyme disease patients are getting any kind of treatment, whether it's antibiotics. I have a list over there of tons of treatments, so if you want to take a look. But any of those treatments can cause a Herxheimer reaction. And basically what it is it's a flare-up reaction of the symptoms, because when a spirochete or when we say tick-borne disease, when any of these organisms are dying, they're releasing endotoxins into the bloodstream and into the body, which makes you feel like crap. So you'll have an increase in symptoms. So you can have flu-like symptoms, muscle aches, headaches, you can feel nauseous, you can have anxiety, panic attacks. I've known people who've had stabbing sensations, pin-like sensations, increase of symptoms like their knees will hurt, their elbows will hurt again, old symptoms will come back. So that's really what a Herx is. So if you have a really good relationship with your clients and you have a solid therapeutic alliance, they're going to turn to you during a Herx because they don't know what it is. They're like, oh, am I dying? They might feel like they're dying. What's happening to me? They might just feel so out of control. And of course, I recommend that you speak with their doctor, or have them speak with their doctor if you're really concerned, maybe like the first time, and then when they know what a Herx is, after that, then they'll know for themselves what it is. But after they've done that and then they checked out with their doctor and everything's okay and it's just a Herx, then you can continue that conversation with them just to reframe it, that reframe to them, this is a positive thing. It's not a negative thing. You're not dying. This is a Herx. This is what's happening. They're just going away. It's so just to reframe it for them, I think, is really important. And then the last thing I want to say is just to seek consultation and supervision from Lyme literate mental health professionals as much as you can, and also Lyme literate medical doctors whenever you need them. And there's a great organization called ILADS, ILADS, that's dedicated to Lyme literate physicians. I don't know how many of you have ever worked with Lyme disease patients before. If this is just like a new thing for you today, but if it isn't, thank you so much for coming. And if you've already worked, then bless you for continuing. So I just think these are some of the most interesting, courageous clients we can work with. So
Thank you. Thank you so much.